Starting with completely clear urine feels like the goal, the thing hydration apps and gym bros brag about. But here's what nobody tells you. Clear urine, especially if it's constant, can actually signal overhydration. When you drink water faster than your kidneys can process it, you dilute your blood's sodium concentration, a condition called hyponatremia. This isn't theoretical. During the 2002 Boston Marathon, a landmark study published in the New England Journal of Medicine, led by researcher Christopher Almond, found that 13% of runners finished the race with clinically low sodium levels, some critically so, precisely because they'd been taught that clear urine equals peak performance and kept drinking water well past what their kidneys could handle. Your kidneys filter around 180 liters of blood plasma a day, but they can only excrete roughly 800 to 1,000 milliliters of water per hour. Drink faster than that, consistently, and clear urine stops being a badge of honor and starts being a warning sign. Pale yellow is the actual target, and this is your baseline. That color comes from urochrome, also called urobilin, a pigment created when your body breaks down old red blood cells, roughly 200 billion of them every single day. The heme from those dying cells gets converted by your liver into bilirubin, some of which becomes urobilin and exits through your kidneys. When you're properly hydrated, that pigment gets diluted into a light straw color, and that's your body running exactly the way it's supposed to. Push toward dark yellow, and your kidneys have shifted into water conservation mode. A hormone called antidiuretic hormone, or ADH, gets released by your pituitary gland the moment blood sensors detect you're running low on fluid, and it tells your kidneys to reabsorb more water instead of excreting it. Less water means the same amount of urochrome gets packed into a smaller volume, and the color darkens. A 2015 hydration study out of the University of Connecticut, led by exercise physiologist Lawrence Armstrong, turned this into an 8-point color chart still used by athletic trainers today, because color alone predicts dehydration more reliably than thirst does. Keep pushing past dark yellow, and you land on amber or honey-colored urine, which is the same mechanism taken further. This isn't a new process, it's dehydration intensifying, ADH climbing, water reabsorption maxing out. Think of it like a factory cutting shipments down to almost nothing because the warehouse is nearly empty. At this stage, your body isn't just conserving water, it's rationing it, and amber-colored urine that doesn't lighten after a glass of water is genuinely worth paying attention to. Orange urine is where the story shifts from hydration to your liver. If you haven't eaten anything unusual, orange can mean bilirubin is leaking into your urine before your liver properly processes it, which happens in conditions like hepatitis or a blocked bile duct. But here's the twist. Certain medications cause the exact same color completely harmlessly. Rifampin, an antibiotic used to treat tuberculosis, is famous for turning urine, sweat, and even tears bright orange. Same color, two completely different causes, which is exactly the trap that made ancient uroscopy an imperfect science even when it was taken seriously for 1,000 years. Pink or red urine is the color that triggers the most panic, and often for the wrong reason. Roughly 10 to 14% of people carry a genetic trait that prevents them from fully breaking down betalan, the pigment in beetroot, resulting in a documented, harmless condition called porphyria. But red urine can also mean actual blood, called hematuria, caused by anything from a kidney stone tearing through the urinary tract to bladder cancer. There's a third, more dangerous cause too: myoglobin, a muscle protein that floods into your bloodstream after extreme muscle breakdown, a condition called rhabdomyolysis, sometimes triggered by an intense workout after months of inactivity. It looks almost identical to blood under normal light, but the underlying mechanism, muscle tissue dissolving, is a genuine emergency. Blue or green urine sounds almost fictional, but it has real documented causes. Certain bacteria, particularly Pseudomonas aeruginosa, produce a blue pigment called pyocyanin when they colonize a catheter or urinary tract. There's also a rare inherited metabolic condition in infants called blue diaper syndrome, first described in the 1960s, where a defect in tryptophan absorption causes intestinal bacteria to produce compounds that turn urine a striking indigo blue. And certain medications and dyes, like methylene blue, used medically since the 1800s to treat specific types of poisoning, can turn urine green or blue as they're excreted, harmlessly, within hours. Brown or cola-colored urine is a serious escalation, and it has multiple possible causes that all point toward real internal trouble. Severe dehydration can darken urine this far in extreme cases, but more often, cola-colored urine signals either advanced liver disease, where bilirubin builds up far beyond what causes simple orange discoloration, or a rare genetic blood disorder called acute intermittent porphyria, where the body can't properly build heme, the molecule at the center of red blood cells. Some medical historians, including physician Timothy Peters writing in a 2010 paper in The Lancet, argue this is exactly what King George III had, and that his quartz dark, port wine-colored urine, along with his reported episodes of confusion, matches porphyria far better than any theory of madness his contemporaries came up with. Cloudy or milky white urine usually points to infection. When white blood cells flood the urinary tract to fight off bacteria, a condition doctors call pyuria, the urine loses its normal transparency and takes on a cloudy, sometimes visibly particulate texture. Hippocrates was already describing this over 2,400 years ago, correctly linking cloudy urine to internal fever without knowing what bacteria were. In rare cases, milky white urine can also mean chyluria, where lymphatic fluid abnormally leaks into the urinary tract, a condition most commonly caused by a parasitic infection called filariasis, still endemic in parts of South Asia and sub-Saharan Africa, affecting over 51 million people according to World Health Organization estimates. Foamy or bubbly urine is easy to dismiss, but nephrologists take it seriously. A little foam from the force of urination is normal. Persistent, dense foam usually means proteinuria, excess protein, mainly albumin, leaking through kidney filters that should be keeping it in your bloodstream. Your kidneys contain roughly 1 million tiny filtering units called nephrons, and when the filtering membrane gets damaged, protein starts slipping through where it shouldn't. Research published in the Journal of the American Society of Nephrology has repeatedly identified proteinuria as one of the earliest detectable markers of chronic kidney disease, often showing up years before any other symptom appears. Purple urine looks almost impossible, but it's a well-documented hospital phenomenon called purple urine bag syndrome, first formally described in medical literature in the 1970s. It happens almost exclusively in catheterized patients with alkaline urine and bacterial overgrowth, where certain bacteria break down an amino acid called tryptophan into two pigments, indigo, which is blue, and indirubin, which is red, and the two mix together inside the collection bag to produce a deep violet color. It looks alarming, but it's chemistry, not mystery. And then there's black urine, the rarest and strangest of them all. The clearest documented cause is a genetic disorder called alkaptonuria, sometimes literally called black urine disease, first scientifically characterized in 1859 by physician Breer-Garrett's predecessors, and later genetically explained in 1902 by physician Archibald Garrett, who used it as one of the founding case studies for the entire field of inherited metabolic disorders. People with alkaptonuria lack an enzyme needed to break down a compound called homogentisic acid, which builds up and oxidizes to a black color when exposed to air, sometimes turning urine visibly black within minutes of leaving the body. Certain medications, like the Parkinson's drug levodopa, and rare cases of advanced melanoma can also, in extremely rare instances, turn urine black. You've got hydration status written across clear, pale yellow, dark yellow, and amber. You've got liver chemistry showing up in orange and, in its worst form, brown. You've got blood, muscle damage, and bacterial pigment competing across pink, red, blue, green, and purple. You've got infection and kidney filtration failure showing up as cloudy and foamy. And at the extreme edge, you've got two genuinely rare genetic conditions, porphyria and alkaptonuria, writing themselves out in brown and black. Every single one of these colors is generated by the same underlying process. Your kidneys filtering roughly 180 liters of blood a day and concentrating whatever your body needs to discard into a few hundred milliliters of fluid. Whether that fluid comes out pale straw or ink black depends entirely on what's dissolved in your blood at that exact moment, which means urine has never really been wasted. It's a live transcript, written in color instead of language, of exactly what's happening inside organs you'll never see with your own eyes.